Medications. The data to fill out this section of the sheet is name of the medication, presentation, dose, routes of administration, frequency, and application schedules. They are circulated with ink of the color corresponding to the chip and the time the medication was applied. In the case of antibiotics, record the prescription in red ink. To control the numbers of days of applications of antibiotic or a specific medications. Write down and the beginning the number of days it has been applied, counting as one day at the end of 24 hours, and so on. The initial dose of the medication is administered at the time the indication is received, and the schedules are adjusted according to the operating instructions for hospital nursing service. When a medication is suspended, write the abbreviation SUSP in the corresponding space. The route of administration will be noted with abbreviations based on the operating instructions for hospital nursing service. The dose will be noted in numbers and abbreviations of the unit of measurement. At the end of the sessions, when each shift ends, the signature of the charge nurse added. In the following session on invasive procedures, the following data is added: catheter or probe number, installation date, date of healing, and number of days it has been installed. These data are added only when there is a peripheral catheter and central venous catheter, or in other cases some type of probes. It is also not if the puncture site shows signs of infections. In the same way, they are written with the color of the pens to which the turk belongs. Below is the sections of the pressure's ultra-risk cell, where is divided by all of cheese. Each one has both which is colored with the color depending on the level of risk in which it is located. Green is when the wanders and there is a little or no risk. Red is the when he does not wander and there is a lot of risk. The interventions to be carried out to avoid the risk are detailed below. An example will be mobilizations according to the postural clock. The second scale is for the risk of falls, which consists of the same as the previous ones divided by shift 10 and its bosses, which are colored according to the level of risk in which the patient is. Green is when it wanders and there is a little or no risk. Red is when he doesn't wander and there is a lot of risk. After this, there are the interventions to be carried out to avoid the risk. An example would be the use of handrails. The next scale in the NIPS. It evaluates pain in the newborns considering facial expressions, crying, breathing, and movements to measure its intensity. On the sheet there are numbers from 1 to 24, where the highest number indicates greater intensity of pain. The calculated number is enclosed, while the color corresponding to the shift, the final score helps determine the net for analgesic interventions. The next thing to place is the location of the pain according to the patients, evaluating the result with the EVA scale, visual analog scale.
Hi, I will talk about of the last part of the page. External habits. This section refers to what nursing staff physically observe in the patient. It includes aspects such as personal hygiene, whether the patient is clean, well groomed, and generally tidy, clothing, hygiene condition of the nails, hair and skin, presence of wounds, rashes, ulcer, etc. Posture and weight, general appearance, indicators of the nutrition of this nutrition, uh, sign of anxiety or calmness. Objective and subjective data. Objective data is the observable and measurable information from the nursing staff. Is the vital signs, temperature, blood pressure, heart rate, and respiratory rate. In the observation of the skin, color, texture, hydration, the breathing, and other physical signs. In the subjective data, information is the information provided by the patient, such as description of pain, discomfort, or malaise. Nursing interventions. The nursing intervention are the action taken by nursing staff to care for the patient, such as administration of medication as per medical instruction, wound care and dressing changes, continual monitoring of vital signs and repose to treatment, mobilization of postural changes to prevent pressure ulcers, and emotional support and education about the illness or treatment. Interdependence problems. These are issues that require the joint intervention of different health professionals. For example, in the infection control, we need a collaboration with physicians to adjust antibiotics. And the management of chronic pain, involvement of physical and physical therapists, or in the neurological deterioration requiring joint efforts with neurologists and therapists. Our tip interventions. These are actions performed by nursing staff are indicated by other health professionals. For example, administration of the medication prescribed by doctors, implementation of treatment from physiotherapy or rehabilitation under medical guidance, and compliance with specific protocols based or orders for other professionals such as nutritionists or specialists. Response and evolution. This section records how the patient responds to the intervention performed, for example, improvement or deterioration of their treatment, response to medication, such as pain or fever reduction, change in vital signs or emotional state, observation of any complication or adverse reactions. Observation. This includes additional comments about the patient overall condition, such as behavioral or physical changes not documented in other sections, special situations or events during the nursing shift, such as episodes of acute pain, falls, or respiratory issues. Also, full information for the next nursing shift. In the education plan, aims to instruct the patient and their family on the care they should follow at home. For example, teaching about medication administration, how and when to take them, specific care recommendations to avoid postoperative complications or relapses. Information about the illness, how to identify warning signs, to seek medical attention again.